Everyone, welcome back to a second chance. My name is Phil Jones, kidney transplant recipient.
And I'm Tafaro Cook, two-time kidney transplant recipient and founder of Kidney Care Coaches, where we coach people with stage 3 to stage 5 kidney disease. If you or you know someone who has kidney disease challenges and needs to be coached, hit us up at kidneycarecoaches.com.
Awesome,
Hi, I
awesome.
am
Well, today,
I I'm a two-time acute myeloid survivor. I'm a stem cell transplant recipient. I've had 7 brain surgeries prior to my diagnosis. I'm a mom. I'm a patient advocate. I have a TED Talk. I'm a freelance writer, on a website, and I'm a fierce patient advocate.
awesome,
Wow,
awesome.
can we that's a lot. Let's start from the beginning. Let's start like okay, let's how did we get here with Amanda? Take us from the beginning with that. That's big right there.
And that's kind of where I want to start off at. Really, was the starting point to her story. Which I know at birth you were diagnosed with double pneumonia. Did you have any effects from the diagnosis as a young kid up into your first major episode of health issues?
I did have scarlet fever at like 3 or 4 from the double pneumonia. I was only in the NICU for a few days, luckily, thank God. But there was after effects that my family really noticed. When I was 8, I was having headaches. I wasn't really listening to my parents. Loud noises bothered me. I would cry all the time, vacuuming, going off, people clapping their hands. And my parents took me to doctor, and she's fine. She's hallucinating. She's young. She just needs attention. Went to Children's Hospital Philadelphia. They got some CAT scans done. Doctors, she's having brain surgery tomorrow. The cyst on her cerebellum.
Hold on. Let me get this correct. From the day of, then the next day you got to have brain surgery.
Went to the hospital,
That's
and the cyst was so big. They literally were like, tomorrow.
that's from 0 to 100 real quick. So let me ask you this though: how was everybody in the family, the parents, and everything taking this in? I know you were 8 years old. Do you remember it? Are you?
So my aunt had cancer uh, a year before I was diagnosed with a cyst on my cerebellum. So we kind of had gone through the aunt having cancer, and I was around, and I had my sister. My grandfather had passed away during that time, so there was a lot, going on in the family. But it kind of was like, this is a hump in the road. We got to get over it. We have to do it, and let's do it. So we kind of just did what we had to.
Wow, man. So, ooh, that's big, man. So after the surgery, how'd everything go after that surgery? Can you go deep in that?
So I actually remember having a stomach ache. The surgeon came in. She was like, stomach hurts. I had pancreatitis.
Ooh.
I guess from the medication. I was in the hospital like for 2 weeks, a little longer than normal, but like I was having some stomach issues. But my head was fine. I remember going back to school, staples in my head. I still have my scar. Lasted for 10 years. Like I was good for 10 years. I did cheerleading. I did softball. I did, everything. I went through life perfectly fine for 10 years. It was a year after I had my brain surgery. My sister was diagnosed with, back then it was called PNET, primitive neural ectodermal tumor. Yeah, but so I went from having brain surgery, and my parents get to my sister having brain cancer almost a year later, like in September. I had my surgery in October, and the following September.
Man, that is wow. So, how many siblings do you have?
Just one
So
sister.
you and your sister going through this with the mom. Man, that's a lot to put on everybody at one time. Um, wow. So after the 10 years, and let me ask you this. They allowed you to do cheerleading, soccer, because soccer you could take some concussions and head stuff and everything, and you were fine doing all those things.
Totally fine. I
It's pretty
was good.
remarkable.
Yeah, 10 years. I was a stent in a little wire that like drained the cerebral spinal fluid, and I
Hmm.
was good. I mean, I I didn't know anything was until I had a cyst on my brain. Everything was fine.
How often would you have to go get it drained when you're in your high school years and stuff like that?
I didn't, and doing my senior year of high school, that's when the headache started coming back, and
Okay. Okay. Wow,
yeah,
man. So let's take us to with the deep dive from your senior year progressing on when you had to go through some other stuff. Go ahead.
yeah. So my senior year of high school, it was bad. I was like, the principal was like, "What's going on?" But I had doctor's notes because I had headaches. I had really bad migraines. I couldn't keep my head up because the pressure was so bad. But the doc, fine, like there's nothing else there.
Mm,
We see your cyst; it's not growing. Like we ended up going back to Children's Hospital Philadelphia. Even though I was 18, I had so they took me,
right.
and, and I had, it was up to me, and I went. They're like, you can have exploratory brain surgery to see what the heck is wrong, or you can stop faking it and not have brain surgery. And I'm not
Mm,
like, I'm having brain surgery. I know something is wrong. I know my body. I don't care what the doctors say. Something. So I think like a month later, we ended up. It was June when I graduated, and August I had brain surgery.
how'd
And
that one go?
they went in, and my cyst ruptured from the pressure, and they realized
Wow.
I had extreme hydrocephalus. I actually had to blood during that surgery because it was so bad. They didn't realize how bad. So the stent had clogged, and there was no test that they had to. So nobody believed me. So when they
Mm,
went in, and after the doctor came in, actually my eyes were crossed completely to this day because he had nicked the fourth nerve um,
oh man.
on my left eye. Long time now, so like I can, my gait is off really bad, but I'm alive, so I try not to complain about the double
Right.
vision.
Right.
But he was like, "You were right," and I was, I know, that's why I wanted it. And he was like, "I'm sorry, I didn't believe you." And my parents were like, "You know best," and I had surgery. That surgery in 2007, and I had another brain surgery because the fourth ventricle of my brain had closed itself because your body heals itself. I had to go back in and reopen it up so the hydrocephalus can drain. And so the cyst is, they can't, it's like inoperable. It's right on my cerebellum, and chance I could like lose all motor function and not be
Yeah.
able to walk or anything.
Yeah.
So they just
Right.
drained it. And, that was good for them. Continuously having headaches, really bad pressure headaches. So after I went to CHOP in 2007, we went to Mount Sinai in 2008, and the head neurosurgeon up there, where it completely changed from my head down into my stomach, and it hydrocephalus, so it wouldn't back up. Unfortunately, in November I had the surgery. it was so bad because it was draining so much. And for years, my body got pressure on my head. So without that pressure, I couldn't function. I was having up. I had to lay down. I couldn't see, like, I couldn't stand noise. So I went back in December of 2008 for surgery for them to put like a valve in so I could keep a little bit of pressure.
Let me ask you something in between all this. This is really mind blowing, man. You having all these things. How was you emotionally, and how did your body feel? Because we know the brain can, controls a lot of things and everything. So let's talk about your emotions, and because you were a young girl at the time and everything. So go ahead.
Yeah. So my college, like I started out at a community college and I was like, I'm not going to go away just next year. And I started and I was having headaches and I had to have surgery. So my friends are out doing their thing and I was having brain surgery. So I was depressed and I was like, what is my life? I had surgery
Right.
in 07 and then in 08 and then again. And like my friends are like, oh, I'm doing this or we're going here and we're going to life. And I'm like, I can't have that.
Right.
So it was hard for me during that time. But I had my
I can only imagine.
family who, yeah, it's hard. But my family is great and they really were there for me and, emotionally a lot. I did go to therapy because I needed it. And, I was upset, depressed, but I talk about it because a lot of people don't talk about it, and a lot of people
Right.
think it's like a
Right.
stigma. But it is what it is. I had it. So then,
Right. I respect that.
after,
Go ahead. I'm sorry. Go ahead.
no, I was gonna say, so after 2008, I was good for a while. The shunt was working really well. And then about 3 years later, I started having stomach pain, and it didn't really come back as a headache. It came back as my stomach was hurting really bad. I have these horrific, almost like cramps, almost spasm, and nobody could get to the bottom of what was happening. And a VP shut down into like your digestive tract, like by your
Mm-hmm.
stomach.
Mm-hmm.
So it like gets everything. So they were like, well, maybe something is wrong with the shunt. So I went to Johns Hopkins. I saw like the top number one neurosurgeon in the world. I needed answers because everyone was like, you're fine. There's nothing wrong with you. But I'm like, I've been told I was fine before and I know my body. Something is wrong.
Right.
So we went and their test done with this like green glow dye thing. And when I sat up everything down, my shunt would not drain and there was a blockage. And so we scheduled the surgery a few weeks after that. And he fixed everything. And he did a VA shunt. It's a ventricular arterial. So it goes in through my jugular right here. You can kind of feel it. And then
Mm-hmm.
into my heart, it's the hydrocephalus and the CSF fluid. When I woke up from that surgery, the team of doctors came in like dressed in gear, and I'm like, what's going on? It was infectious disease. And they said you had staph infection and nobody knew. And if it would have went to your brain, you could have died. But thank God I didn't. Stay in the hospital for 2 weeks. I actually went to a nursing home. I transferred hospital New Jersey, and that was Maryland. And I stayed in the hospital getting intravenous antibiotics every 4 hours because of they wanted I didn't have any other disease in my body or that it went to my brain or anything because I had just a brain. It was a scary time.
Yeah, I can only imagine, man. And shout out to John Hopkins. That's where I got one of my transplants from. I give it love. So they can go make you go through some stuff, but they do know what they're doing. In the long run, I could give them love though. So let me say that. Wow. So how was the process of you recovering from the staph infection? Because people don't know. I've had staph infection one time, and it can make you feel like crap. It makes you feel really, really bad. People don't know this. They think, oh, I have staph infection, but when you get it sometimes when it in a hardcore way, it can make you feel really, really bad. And they're giving you medications. Uh, Even like 4 o'clock in the morning, you're getting this medication. Like it's round the clock medication. It's nonstop. So I understand what you're saying with that. So after the staph infection and everything cleared up, did the doctor at John Hopkins get everything correct for the most part? Excuse me.
Yeah, everything was good. We had to like try different the valve that I have.
Mm-hmm.
But we figured out a setting because how much pressure you need on your brain because
Right.
I was so used to the hydrocephalus. So something new in, so we tested it out, but I was in like constant contact with them. They were great. I went to my thing was amazing until I got pregnant in 2013 and that surgery. I was 16 weeks pregnant.
16 weeks pregnant, and then you had another surgery?
Yes. So when you're pregnant, so you can pump blood, throughout your body. But
right.
The problem was I had a VA shunt in the right atrium of my heart, and I felt like I was having a heart attack. And so I went to the doctor. I told the oncologist. I went to a cardiologist. They had no idea. Back to John Hopkins, and I was like, I think something's wrong. And then they did the test, and they're like, oh, like we need to shorten this. So 16 weeks pregnant. It was literally like 4 days after my mom got married for the second time to my stepdad. I had brain surgery. I went in, and they cut my hair. They took the valve, cut it, put it back in, and good. But I wasn't on pain medication because I was pregnant. So that recovery was horrible. But I don't.
Right. And so after that, you had a great birth and everything. I mean, everything went well with the birth. That's amazing.
Yeah, he was born healthy December 24th, and he was 8 pounds 15 ounces.
Oh, he was a big kid too.
Yeah.
He was big. That's cool. Okay, that's good.
Yeah, everything.
Wow, that's amazing. So Amanda, so
yeah,
let's take a. Let me think real quick. You going through all this. You had a baby and everything. How are you processing all this right now at this time? You're a new mom. All these things are going on.
Yeah, I was. I mean, I was happy. I was grateful. Everything was great. Life was amazing. I was a mom. I had a kid. I'm like, all right. Having brain surgery is like I could have died times. I was just happy. I've always wanted to be a mom. So life was. I was like, I'm gonna be a good mom. We're gonna go to the park. We're gonna do all these things. I have so many missions. And then my son was 3, and God will get. You gotta have cancer.
Wow. So let's Phil, are you with us?
Yep.
I don't know where Phil was, but I don't know if you know, Amanda. Phil's had I never had brain surgery. I've had enough surgeries, don't get me wrong, but I never had brain surgery. Phil has had brain surgery as well, so he could definitely identify with this. Phil, you know me, I can keep on running my mouth. So go ahead, Phil.
All right, we'll go to a commercial and we'll come back.
Okay, so we're gonna go to a commercial and then
everyone. I'm Camille Cook, the family nurse practitioner, the creator, the developer, the chef, and the cook of crack. Well, Creamy Crack, the addictive, all-natural body cream. I have a background in dermatology and cosmetic surgery, and I created a 98% organic and a 2% all-natural body cream in 2011 for both my son and husband. My son, who suffered from the irritating symptoms of eczema, and my husband, who was a 2-time kidney transplant survivor and who was on kidney dialysis for over 10 years. They both suffered from the dry, itchy, scaly, and flaky skin. And as a mom and a wife, and with a background in dermatology as a nurse practitioner, I couldn't stand back and see them suffer any longer. So I got into the kitchen and started cooking crack. Well, Creamy Crack again, the all-natural body cream. It moisturizes, it replenishes, it restores, it heals and protects your largest organ. You got it, your skin. I have been able to make such a difference in the lives of those people who suffer from the irritating symptoms of being on kidney dialysis or who are awaiting a kidney transplant, and also for those who suffer from eczema. Those people or individuals have suffered way too long and tried too many things to help their skin come back to life. I am so honored and grateful for you to try this all-natural body cream. Again, that's going to help you look and feel better with your skin. Creamy Crack can be found on all social media platforms at Creamy Crack Body Cream, or can be purchased at creamycrackbodycream.com. I look forward to serving you, sharing with you, and making an impact in your life. I hope you'll go out and try Creamy Crack, the addictive, all-natural body cream. Thank you.
Welcome back to a second chance, Mr. Cook. Go ahead.
Okay, I thought you had some questions. You good?
Yeah.
Okay. So go ahead. Let's talk about the cancer you told us you just had. Wow, man.
Yeah, so 19, I started really feeling lethargic, and I was bruising easily, tired a lot, and I had went to the emergency room, and he was like, "Oh, I think you'll go home, eat some red meat. You're a little overweight. You know, you have a 3-year-old, probably just tired. Go rest." And I was like, "All right, like maybe it's in my head. Home and try to get some rest." 2 months later, I was dry. I was like gray. I had no color. And I just like I felt like it was hard to breathe. I couldn't live life. May it was the 16th. I put my son to sleep. I am going to go to the emergency room. Like, I think somebody just go get checked out. Why are the babies sleeping? That way I'm not interrupting his schedule. And I didn't come back. Was told my hemoglobin was a 5, that if I would have went to bed that night, I probably could have died in my sleep, because leukemia was eating the blood and my heart was trying to pump so much blood. My heart was hurting, and like it was just really bad. And I found out I had blast March, but the doctor didn't see it, or they didn't catch it. So I was living months and I had no idea. So by the time it was caught, it was so bad. So I went from going in the emergency room to staying overnight to finding out I had leukemia. Me to another hospital where like I knew some doctors, and really bad. You need to see a specialist. So they transferred me to the National University in New Brunswick.
Mhm.
And and I had cancer. I relapsed. I had cancer again. And then I had a stem cell transplant.
Girl, you going, man. So the stem cell transplant. I worked with a kid right after I had my first transplant in 2008, and he had a stem cell transplant. And that was the first time I was introduced to stem cell. It's pretty different than a kidney organ transplant. This is different. So can you tell the audience a little bit what a stem cell transplant is?
So a stem cell transplant is literally your entire immune system. They give you chemo it's like not even conditioning chemo. It's the harshest chemo you could get because they want to kill. They kill all the cancer. They kill your whole immune. And then right when you're at the point where you're just about like not able to take it anymore, they give you some stem cells. And it's like a bag that looks like it's from a stem cell donor who sometimes you know them, sometimes you don't. I had an unrelated donor. He was from Germany. I had a man because I had which is a whole other topic of different kinds of donors that you can and can't get. And he donated, and it's really like you're reborn all over again. So I have his DNA now, and like to different medications or any like seasonal allergies he lived in a different part of the country. So even like now I'm learning I never had before. I have now because his immune system was part of the country where they don't have the same trees or they don't have the same pollen, same dust that we have here. So
Right.
Things like that are different. Cell transplant. I learned I was allergic to sunflower oil. I ate it and had to the emergency room because I was swelling up. And so it's really living each day, for yourself, and you literally get a second chance at life, and you just you really have to have faith in you and have a lot of hope and believe that it's going to help you because it's hard. It's not easy. You is so strong, and you have to learn your body all over. When you're a newborn and you get like newborn shots, and when you're 1 year old, you get 1-year-old shots, and like each wellness all over again. So right now I'm
Right.
4 years old. When I go to I'm like, even though I'm 34, my chart says I'm 4 because I have it, and I don't have any of those vaccines that I ever had before. I don't have any of those I once did, and everything's brand new all over again.
Wow, that's a lot to learn, man. And the unknown, like you said, you some sunflower seed oil, and all of a sudden it ends you in the emergency room. You don't even know these things, at all. So you're just flying without without radar, really. So how was that recovery with that? Besides, the unknown, how was the recovery with the stem cell?
Stem cell transplant was hard. I had my
Yeah.
induction chemo like May 7th. I did 4 consolidation therapies, and then I was cancer free for 6 months, and then I relapsed again, and then they found out I had so the doctor, after I relapsed and I had my second, like, you need a stem cell transplant, you have to do this. They gave me a 10 to 20% chance to live. They're like, you have a stem cell transplant to save your life. So I went home after the second induction, and 3 weeks later, on Thanksgiving 2018, I went to the hospital. On November 28th, I received my stem cells. So it was like back to back. And it was really hard because I had a 3-year-old who turned 4 time, and like I went from being a full-time cancer patient. My life completely
Right.
changed. I was in the hospital for a month at a time. I went, and it was a lot. It was hard, and the stem cell transplant was the absolute hardest. I was depressed, up at all whatsoever. When I went through my induction chemo, so he could come once a week, like every Friday, his dad would bring him up to the hospital to see me. Transplant, you can't have any germs. Like when
Right.
people came in, they
Right.
had to wear, like, make sure they weren't bringing
Mm-hmm.
outside germs in. Like the nurses had to go through like the suction doors to spray them. It was real, and that was pre-COVID.
Right.
Like
Right.
I couldn't see a lot of people. My sister couldn't come up, like just my mom, and like it was hard because I just was like lonely. And even though the nurse was wonderful, and I could walk around and see some of the other patients, it just wasn't habitat. It wasn't my people, like it wasn't me.
Right. Right. Man, that's wild. Phil, you have any questions?
No, I'm just enjoying the conversation, honestly.
Okay. Wow. So after the second stem cell, how do you go back to, you're recovering and everything? You have a son. How does life, how does life, how do you, go on, continuing on with life? That's the question.
So it was really difficult. So after I came induction chemo, it was October 22nd, and if you're a wrestling fan, Monday Night Raw was on, and announced he had leukemia, and he had to relinquish his title. But my son was a huge fan, and for him to see his hero, same disease as his mom, my son was like, "Oh my God, like somebody else has leukemia. My mom's a hero. If he's strong, my mom's strong. If he can do it, my
Right.
mom can do it." So I used wrestling terms to my son to explain how I would say, I felt like I got suplexed, or like, oh, I felt like off the top rope, or oh, I feel like I got kicked in my side. So he would understand the pain. Wrestlers, and they look like they're in pain. He, as like a 3-4-year-old, stands like, okay, mommy isn't feeling good right now. I can't really jump on her. We kept hurting. And it made what I was going through more relatable for him. And
He can identify.
Yeah. So then when I went back to the hospital to have the stem cells, I understood a little bit more. The Zoom calls and the FaceTime were a little bit still really hard because, he wanted me to be home. He didn't understand. Why do you have to be in the home? You can't come home. When are you coming home? He was going to dating friends. He was going to birthday parties, and I couldn't be a part of any of it. I was in the hospital. I had cancer. There was nothing I could do except for die. Like, there was nothing I could do. I had cancer, and I had to be in the hospital to save my life. Him, as a 4-year-old, didn't get that.
Right.
So
Right. With all this going on, what was your who was your support system?
well, really, my family was an amazing support for me. My mom came up to the hospital like almost every day. My dad, my sister, just everybody really was there. But for me, the leukemia and lymphoma, because I had leukemia, was there. Like, they were a huge support. They housed their copay assistance, their peer-to-peer support, just really avenue. Like, I felt like I needed help I wanted to talk to somebody, or or like I needed something, they were there for me. So I was lucky enough to have an amazing that I could fall back on. I
That's awesome.
needed that help.
That's good.
Yeah.
That's good to hear. That's good to hear. So, like, did you have any more surgeries after this?
So the only other surgery I've had was during my reduction chemo. About 4 days in, my appendix was ruptured, so I had to have an emergency appendectomy. And that hospital has never done emergency surgery on a active chemo patient before. So it was new for the doctor and we didn't know what the outcome was.
Wow.
Because I had cancer. Like I could have bled out. I was on all this medication. They gave me during and after surgery. And the doctor came up afterwards to have an angel because you didn't bleed out at all. Everything went perfectly fine. Yucky. And I was like, yes, because I have faith.
Go ahead, Phil.
I really just want to know. Just really the only question I have left was how was your mindset when you relapsed in 2018?
I did the whole why me thing. It was September 11th when the doctor called. My son just started school. The doctor gave me a week. I went in to start chemo. He was like, it's really bad, but have a week. Oh, what was going to happen? I didn't know if I was going to live or if I was going to die. I used that week to go to the zoo, make videos for my son, just in case I wasn't there. And I was sad. I was very depressed, but I really dug deep in my faith, and I love motivational quotes. I post them all the time because they really helped me. I started breathing exercises. I always wrote, I wrote when my sister had cancer and my aunt had passed away. It really helped me. So I started a blog when I was first diagnosed, and on Facebook Live, just letting people see what I was going through, and I was being raw and I was being real.
Right.
And I
authentic.
And I posted, and I wanted people to really see what it was like going through cancer, like the bad and the ugly, the raw, the real, everything. I mean, diarrhea, emergency surgery, throwing up, medications, not being able to pay it, the stress of tolls, gas, expenses. I mean, you name it. I talked about everything. I needed to get it off of my chest. It was like therapy to me. Just talking helped me release it. And I didn't hold it in anymore. I let it go. And I really think writing kind of saves me.
Man, that's
So what kind of support did you see gravitated towards you from doing those things?
Well, so I had a Facebook page, and I just kind of shared family and friends this is what I was going through. I didn't want to make 100 phone calls a day and text everybody like, oh, I'm getting this today or this. So, and then they would share it, and they would be like, oh, please pray for Amanda, or like share it with people that they knew that had cancer, or other patients in the hospital. I would share it, and it kind of like grew, and then I ended up starting a website where I, about, or I would find charities, that would help people, or I just wanted to kind of like help other people who were going through what I was didn't have the voice that I've found. So I really just started everything out there, getting information out there, connecting other people. I started talking, like anybody who would listen, I would tell my story to. Anybody I would talk to, and I still do to this day. My email address is on my Instagram. Like, I'll talk to you because I don't want anyone to feel alone in their journey at all. The cancer community, the transplant community, we're so loving, and so that you don't ever have to go through it alone at all. Like, just what we're there for you. And writing really helped that. I mean, I've had several journal. I have a TED Talk. I've been in the Philadelphia and Cancer Today magazine, and actually my son wrote a book. I have it here live, and it helped him also kind of get what he was going through off of his chest, sick, and how he felt about it. So it's helped so much, meeting other cancer patients and talking to different and getting that gray area, that stigma around cancer to kind of go away.
Man, go ahead, Phil.
No, I was gonna pass it back to you, sir.
Okay. I love that you're an advocate for all these things. You saw this happening, and sometimes when we go through things, we like, hold on, man, we can help other people with going through what we're going through, and that's what Phil does, and I do as well. But that's awesome that you've seen that, and then your son writes a book. You're starting the advocacy at a young age with him, where he's gonna be able to help people as he goes through his life. He's gonna be a healthy, strong young man, but he saw what his mom went through, so he has a passionate heart, externally, emotionally, and he's a humanitarian that definitely wants to help people, and that's good that we carry that on. He sees that. That's wonderful. So with the TED Talk and things like that, and all the things you've done, that's helped you inspire a lot of people and everything, and it also helps you when you feel like you do a talk or you might have to go speak somewhere. It feels like you're giving back, and I feel personally when you give back, is nothing more greater than that feeling. So let's
Yeah.
talk about how'd you get get the TED Talks and things like that.
I just started writing, honestly.
Yeah.
I wrote for London, and I would write what I was feeling, and I would email people, and I'd be like, "Hey, my name's Amanda. I wrote this, and I was just wondering if you would publish it." That's how I started. I have a Facebook page. This is how I felt, and it was okay enough to publish. And I started getting my name out, and like I kept adding to my website, and I just kind of made a name for myself. I made sure I branded everything the same way, so a name, and I put myself out, and I was relatable to cancer patients because I would talk about things that were kind of sticky. Cancer isn't black and white. It's not like the movies. You don't get cancer, go through treatment, or you die. Like, that's it. That's not it. There's a huge gray area. So many things that go into, stem cell transplants or blood transfusions or and bills and gas and tolls and the cars driving so many miles and the maintenance you have to do and the food you have to eat. The good food that the nutritionist tells you to eat is 3 times more expensive than the stuff you can afford. Going to therapy and getting medication and switching of medication or your everything. I just felt like it was such a great.
You said it in a mouthful right there. It's everything, like you just said. From paying tolls to the emotions. Okay, I got to get ready for this appointment. Okay, this appointment this time. Rushing back and forth. Okay, I get my son to school. It's a whole lot that people don't take in consideration, and that's when you're talking about that gray area. That so it could be appointment that was scheduled on the doctor had something to do. Okay, then you got to go back. It is so much when you see when you're going through these things that the gray, it's like the black is so small, the white is so small, and this gray area is so large, and the
Yes.
gray area is such the unpredictable of what can happen, and you always have to be prepared for the unpredictable. You're like waiting for whatever's unpredictable to happen because it's going to happen, and that's the crazy part of it
Yep.
right there. So, um, where are you at right now with your health and everything? Is everything in readmission?
Technically, no evidence of disease. I'm
Right.
4 years. Usually for leukemia, they say that 5-year mark is really critical. Actually had a
Wow.
emergency extraction in my tooth yesterday because chemo teeth. So I have spinal stenosis. I have herniated discs. I'm in pain. I have chronic graft-versus-host disease. I have one good day and I can be out playing with my son or going to his football game, and then 3 days I'm in bed with a heating pad and I can't move
Right.
because I'm still recovering. And that I has had such a toll on my body. I complain because, like I say, like I'm alive, but each day I'm gonna face. I don't know if it's gonna be a good
Right.
day. I don't know if I'm gonna be in pain. And part of being a cancer survivor. But I'm here and I'm happy. I'm advocating and I want to get out there, that gray area is where a lot of cancer patients and survivors live. And I don't feel like that stigma is good for us. Like the C word. Oh my God, the C word. Is there such stigma attached to it? How come it can't be like, okay, you have cancer, let's treat it. Help. Like, what do you need? And I just feel like advocacy is where I'm meant to be. My mom said to me when I was going through my treatment, like, for a reason. You've had double pneumonia, you've had 7 brain surgeries, you had cancer, and then you had it again. God put you here for a reason. You're here for a reason. Felt like my reason is advocacy. I feel like I found where I'm supposed to be. I think that and that's what it is.
Awesome, man. Awesome. Phil?
I have no more questions. You was good.
Okay. Well, man, Amanda, your story is amazing. I think you will reach that 5-year limit where you don't have to go through anything else, and I think you'll be fine. That's amazing. Keep doing the great work, and thank you for sharing your story. I have no more questions. I'm kind of blown away. I'm just sitting here like, sometimes I think my story is profound, but when I hear other people's stories, it just gives me encouraged. Like, okay, you can keep on going. You can keep on going because you hear these stories, and you just and like Phil and I talk about, you can interview 20 people and everybody has a different story, and the stories are phenomenal. Each one is amazing on top of one. So keep doing your work, keep on advocating for people and people with cancer and things like that, and you stay healthy as well. And thank you so much for
Try.
being on our show.
Thank you for having me so much. I'm so grateful to you guys. Thank you for listening to my story.
It was awesome and it was very, very powerful. So we appreciate you.
It was. We definitely appreciate you joining us this evening, and thank you for being able to move up the time today. We appreciate that as well. So just to make a quick 2 announcements. Coming up March 9th for World Kidney Day, we'll have Kidney Day webinar with Dr. Shrika Brookings and Chef Lana Carroll. Dr. Brookings will be talking about the recent advancements within kidney care um, and what's going on in that area. And then Chef Lana Carroll will be doing a cooking demonstration for kidney patients. And then March 30th, we'll be having our FSGS conference. We're in the process of getting the rest of those presenters ready. So more announcements on that will come. This webinar is also sponsored by Trio International. We appreciate them for their sponsorship, and we're looking forward to this event coming up this March. A number of other things coming up. We have our Women's Day special edition for Second Chance magazine coming out in March as well. And a number of other things that'll be coming out through announcements also on social media. So look for those. Again, Amanda, we appreciate you. Appreciate your time. Thank you for your awesome and courageous story.
Really.
Uh,
Phew.
we'll definitely be contacting you again because we 9 times out of 10 we always do follow up panel or something like that. So we'll definitely be bringing you back on a lot sooner than later. So again, thank you very much.
Yes,
Thank you for having me. I would love to come back.
Appreciate it.
Awesome. Well, everyone, thank you for watching. Have a wonderful week. Have a wonderful weekend coming up, and we'll see you next Wednesday.
Peace.